पारुल, आप ब्रॉडकास्ट कर दो एक बार।
हाँ, मैं YouTube का कर देती हूँ।
YouTube में तो हो गया।
नहीं नहीं, शी ब्रॉडकास्ट मैसेजेस ना, तो उसमें भी काफी लोग रिमाइंड होके आ जाते हैं।
अच्छा,
वो
YouTube
मुझे
का
भी आता है
लिंक
ना,
ना,
क्योंकि
YouTube का लिंक है।
वो मुझे भी आता है, तो
हाँ, नहीं, we are live on YouTube anyway.
वी आर लाइव
That's why
राइट
ना, that's why मैं शेयर कर रही हूँ।
नहीं नहीं, शी ब्रॉडकास्ट मैसेजेस ना, तो उसमें भी काफी लोग रिमाइंड होके आ जाते हैं। वो मुझे भी आता है ना, क्योंकि मुझे भी आता है कि
हाँ, नहीं, we are. We'll wait for another 2 minutes and then we'll start, I think, no?
yes I guess so.
अभी तक शो नहीं हो रहा है YouTube पे।
Brinda, would you share the link in the PBS group?
नहीं, आ गया।
Yes, I will just.
आ गया, मिल गया।
It's a regular link, so you can take it from anywhere, yeah.
नहीं, लाइव का डायरेक्ट लिंक लिया है ना YouTube का।
I've shared it again across groups.
हाँ, we are receiving.
स्टार्ट करेंगे वृंदा जी?
हाँ. Please, let's start.
Yes.
And we are live on YouTube, so we'll be sharing the link again, just
Yes.
in case people have not been able to see it due to whatever reason.
ठीक है। नमस्ते, मैं पारुल। शनिवार के हमारे आज के DSFI के सेशन में आप सबका स्वागत है। मैरी क्रिसमस टू ऑल ऑफ यू। और जैसे कि आप देख ही रहे हैं, मैं और मेरी दोस्त समीक्षा बिल्कुल क्रिसमस की फील में है। और मुझे ये पता नहीं चलता है कई बार कि ये क्रिसमस की फील है या ये बंगाल की फील है। ये दोनों मुझे कुछ ना मिली जुली सी हमेशा लगती हैं तो इसीलिए मुझे थोड़ा थोड़ा क्रिसमस भी अपना ही लगता है। तो आज हम क्यों बात करने वाले हैं दांतों के बारे में क्रिसमस ईव पे। दोस्तों, ये जो समय है क्रिसमस का, इसमें हम चॉकलेट्स एंड केक्स बहुत खाते हैं और इसके बाद हमारे अपने जो त्योहार भी शुरू हो जाते हैं हिंदुओं के, या यहाँ हमारे इंडिया में जो खाना भी सर्दियों की वजह से शुरू हो जाता है, उसमें मीठा बहुत आ जाता है, ड्राई फ्रूट्स आ जाते हैं, तो वो भी हम कंज्यूम करते ही करते हैं, खासकर नॉर्थ इंडिया में। तो उससे भी कैविटीज जिनको होती हैं उनको प्रॉब्लम आ जाती है। और सबसे बड़ी बात होती है कि में दर्द होता है, और दर्द तो दर्द होता है, और ये एक ऐसा दर्द है कि जो दांत में दर्द होता है और डॉक्टर के पास जाओ तो और ज्यादा दर्द होता है। तो आज मैं इसका सॉल्यूशन आपको देने वाली हूँ। एक ऐसी डॉक्टर से मिलवाने वाली हूँ जो प्रैक्टिस ही इसी में करती है कि वो पेनलेस ट्रीटमेंट उनका होता है। तो डॉक्टर निधि गुप्ता, जो एक फेमस डेंटिस्ट है हमारी दिल्ली की, उनका जो स्पेशलाइजेशन है वो इसी में है कि वो पेनलेस एंड प्रिवेंटिव डेंटिस्ट्री में काम करती हैं। तो आज इस खास मेहमान से मिलवाने के लिए मैं अपनी दोस्त समीक्षा सांडवान को आमंत्रित करती हूँ कि वो आए और हमारी इस खास मेहमान को, हमारी प्यारी सी दोस्त डॉक्टर निधि गुप्ता को आमंत्रित करें।
Yeah, thank you so much, Parul, and I'm happy to be in this session and talk about my friend, and my painless smile is a contribution of her in my life too. And yes, as Parul rightly mentioned, that it's a Christmas theme, you can see, but I think for festivals Indians have put their calendar in such a way that every 3 or 4 months they will have some festival coming and sweets floating in, and they get excuse of enjoying sweets and everything.
Yes.
So we have our dear friend, Dr. Nidhi Gupta. I think in our community or in any person who is connected to DSFI, they need no introduction of hers, because half of them must have already experienced her expertise on preventive and painless dentistry. And of course, they have been our go-to person, Hannah Brenda, for every dental issue. And they have been tremendous. I mean, Dr. Nidhi Gupta and Dr. Anurag Gupta, I think every time tooth comes in picture, they are the people after them that, the picture comes in our mind. So not wasting a lot of time on the introduction, because we already know about them. And the best part of being a friend with Dr. Nidhi is that tooth will never pain. And even if it pains, you get to meet your dear friend every time. And it is so enjoyable to be with her when, you are undergoing a so-called, very difficult treatment.
Yes.
And despite her medical challenges, her own health, she so dedicatedly, heals the patient that it's just not here, but here, and here also you smile. Thank you, Nidhi, for doing that and keeping it really informal. So sorry for that, but everybody knows you and they know how you go about your profession. So over to you. And we would really like to hear that how we can still manage to eat sweets.
Hey, thank you, Parul and Sam. You are two beautiful, gorgeous ladies in my world. And you make me smile more than I make you smile with such overwhelming introduction, though it was not needed, seriously. And one thing I want to say that sweets and Indian tradition, they go hand in hand. If I say remove sweets, you will remove me from the Zoom meeting.
Actually,
that
हमें
is
ऐसा कुछ चाहिए कि हम केक और मिठाई और ज्यादा खा सके और हमारे दांत सही रहे. हमें ऐसे डॉक्टर चाहिए.
So yes, Parul. See, when we talk about cavities, it is mostly the refined sugar. It is mostly the inability of the mouth itself to clear the remnants of the sweets. Sweets has nothing to do with the cavity. जो हम मिठाई खाते हैं उससे cavity नहीं लगती है. क्या हम मिठाई खाने के बाद अपने दांतों को क्लीन करते हैं? 1 मिनट के लिए अगर हम सोचे कि मिठाई खाने के बाद मैं जाके फटाफट कुल्ला कराता हूँ पानी से कर आती हूँ, I think 50% chances of cavity will reduce there and then only, because acid production will be reduced. It is only the acid which is going to remove the outer part of the tooth. Enamel, we all know enamel, जो दांत का white परत दिखता है, the outer layer which we see is enamel, right? And it is the protective covering for the tooth. ये protect करता है tooth को. But once it goes, the tooth becomes very prone to caries. अगर ये निकल जाता है, नीचे एक डेंटिन सॉफ्ट लेयर होती है जो जिसमें ठंडा गरम लगता है, झंझनाहट होती है.
Yes.
That is more prone to caries. So our aim should be that whatever you eat, see, nobody is stopping you from eating sweets or cakes. आप जितना मर्जी खाओ, लेकिन खाने के बाद एक बार जाके कुल्ला जरूर करके खाओ. So that is the main crux. That is where we lack. और कई बार क्या होता है, हम कभी मेडिसिन ले रहे होते हैं कुछ, या कोई हमारे को स्ट्रेस होता है, एंजाइटी होती है, या स्कूल चेंज हो गया, या डाइटरी हैबिट्स बहुत ड्रास्टिकली चेंज हो गई हैं. देन व्हाट हैपेंस, द फर्स्ट इफेक्ट इज दैट द सलाइवा it reduces. When the quantity of the saliva and the quality of minerals secreted in the saliva, they reduce, then the child or the adult gets prone to caries, because जो clear कर सकता है food remnants because of the flow of the saliva, that also gets reduced. So nobody is stopping you from eating sweets. One, make sure you cleanse your mouth or you brush it nicely after having sweets, because sweets में क्या होता है, it leads to more acid production, it leads to the activation of more karyogenic bacteria, but it is temporarily, वो अस्थायी रूप पे ही है बहुत. पर आप अगर उसको क्लियर आउट कर देते हो, रिंस करके और ब्रश करके, तो आपका जो होम्योस्टेसिस है, माउथ का जो इक्विलिब्रियम है, वो वहीं आ जाता है. तो पारुल एंड सैमी का कहने ने एक्चुअली मुझे इसलिए इनवाइट किया था throughout the New Year celebration, she want to make sure कि वो लोग भी अच्छे से केक खा सके, and she want to make ensure that all the parents and children can also relish and enjoy eating the cake.
एक्चुअल में बिल्कुल वो मैंने आपको बेशक मजाक में बात कही थी, लेकिन ये सच में है समीक्षा कि ये वाला जो टाइम आता है हम बच्चों को भी बहुत जो होल्ड बैक करते हैं कि नहीं ये नहीं खाना है, ये मत खाओ, ये हो जाएगा वो हो जाएगा, तो मतलब पूरा वो त्योहार का एक मजा जो है, वो छुट्टियों का जो मजा है, थोड़ा सा किरकिरा तो होता है इस चीज से।
Yes. और इसमें एक चीज और है जो हमारे दांतों पे चिपकने वाली चीजें हैं, जैसे चॉकलेट्स है,
जी
चॉकलेट चिपक जाती है, या ओरियो बिस्किट चिपक
चिक्की
जाती
इन
है।
दिनों में आती है बहुत, वो जो खाई जाती है।
चिक्कीज आर स्टिल गुड बिकॉज उसमें गुड़ होता है,
गुड, यस,
है ना। तो ये जो रेडिली फर्मेंटेबल शुगर होती है, जिसमें एकदम यू नो विच रियली ब्रिंग्स द पीएच ऑफ द माउथ डाउन, इनके बाद जरूर 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 कुल्ला करें, या इसके बाद कुछ ऐसा फाइब्रस फूड खाएं। जैसे हम अपने पेशेंट को बोलते हैं कि आप बच्चों के टिफिन में अगर आप स्वीट्स दे रहे हो तो दे दो, कम से कम एटलीस्ट कैरेट के या कुकम्बर के 5 पीसेस दे दो साथ में।
अच्छा,
तो क्लियर कर देता है वो, you know, because whatever fibrous you will eat, it will stimulate the production of saliva. It will clear out all the remnants from the mouth. So this is a good tip and a trick by virtue of which you can actually reduce the incidence of caries. कि कीड़ा लगने की जो incidence है, जो क्षमता है, वो कम हो जाए।
So I think if we keep the surface of our tooth clean after anything we eat, we will have a social visit to Dr. Nidhi, not a patient visit to Dr. Nidhi.
Not a dental visit.
No, it will not be a consultation, but a celebration, you know.
Yes, celebration together for the new year.
अच्छा डॉक्टर निधि, एक और चीज मैं आपसे जानना चाहूंगी कि अगर कैविटी आ जाती है और उसका क्या एक प्रॉपर ट्रीटमेंट होता है? ठीक है, हमको तो दर्द या ठंडा गर्म लगने लगता है तभी पता लगता है, या कुछ मीठा खा लिया हमने लगा तभी पता लगा। एक तो मैं ये जानना चाहूंगी कि उसका ट्रीटमेंट क्या है, फर्स्ट ट्रीटमेंट क्या है। एक ये जानना चाहूंगी, क्या हमें रेगुलर विजिट करनी चाहिए कैविटी नहीं आई है तब भी, और वो कितने अंतराल पे होना चाहिए?
ठीक है, मैं एक शेयर कर सकती हूँ स्क्रीन पे ना?
बिल्कुल बिल्कुल।
Yeah, you have.
मैं केवल एक स्टेजेस ऑफ कैविटी यू नो वो दिखाऊंगी। मैं बहुत डराने वाली नहीं हूँ।
नहीं नहीं, बिल्कुल आप दिखाइए।
इसमें अगर आप देखोगे एक्सट्रीम लेफ्ट पे इट्स अ हेल्दी टूथ, है ना। हम अपने आगे के दांत, अब आयरनी ऑफ द सिचुएशन इज वी कैन सी अ फ्रंट टीथ, वी कैन नॉट सी अ बैक टीथ, राइट। A front teeth still have very simple surfaces, you know, it's like front and back, you can see. But the back teeth, they have 4 surfaces, out of which maybe 1 surface or 2 you can see, the other are hidden besides the other teeth, or you know, below the gums also. So क्या होता है, whenever a cavity begins to form, actually there is a small discoloration which starts to happen, जो कि शायद आप लोग नहीं देख पाओगे
जी,
you know. And at this stage अगर आप डेंटिस्ट के पास विजिट करते हो तो ये कैविटी रिवर्सिबल है, क्योंकि इसके अंदर कीड़ा केवल इनामल में है, आउटर लेयर में। तो कुछ प्रिवेंटिव प्रोटोकॉल्स करके, फ्लोराइड ट्रीटमेंट करके ये रिवर्स हो जाती है। लेकिन जब एक्चुअल ब्रेकडाउन हो जाता है टूथ का, जैसे कि आप इसमें देख रहे हो, एक्चुअल ब्रेकडाउन हो गया है, डिस्कलरेशन हो गया है, दांत ब्लैक हो गया है और ये डेंटिन में चली गई है, तब तो हमारे को इसके अंदर फिलिंग करनी पड़ेगी। अगेन वो डेंटिस्ट ही सजेस्ट करता है कि इसका क्या लेवल है, क्या ये डेंटिन में है, क्या ये नर्व के अंदर चली गई है। और इसके आगे अगर आप पिक्चर देखोगे तो पूरा ही काला है, मतलब यू कैन ऑल्सो मेक आउट कि इसको तो रूट कैनाल की जरूरत है, क्योंकि इसके अंदर कुछ रहा ही नहीं है।
My tooth when you treated.
And in the last stage still it is, you know, salvageable. अब इसको हम अभी भी बचा सकते हैं, लेकिन if the tooth has gone beyond this stage then it demands extraction, तब तो हमें निकालना पड़ता है। लेकिन एक बहुत मजे की बात है और एक अच्छी गुड न्यूज ये है कि ये स्टेजेस पहुंचने में 6 months to 5 years लगते हैं। Isn't that a good news? It's a good news because अब इस टाइम के बीच में अगर आप डेंटिस्ट के पास जाते हो एंड डिपेंडिंग अपॉन द डिफरेंट स्टेजेस वेयर द caries formation or cavity formation is, your dentist will be able to save the tooth at that stage so that it doesn't progress more. तो अगर हम इनिशियल स्टेज में देखते हैं कि कैविटी बनने की उसके अंदर it is prone to cavity, or we check the patient mouth and see the oral hygiene, we suggest them that go for preventive because it will prevent the formation of cavities, keep the oral hygiene intact, and it will actually help in the formation of a preventive habit for the child and adult alike. And it's a lifelong investment. I mean, for once a tooth get cavitated, it's either an adult or a child, that means he or she is already prone to cavity. So if we fill one cavity, doesn't mean that he or she may not have cavities in future, unless and until we break down that habit. We break down that habit of cavity formation, and that's where the preventive dentist comes into role.
इसे थोड़ा सा और एक्सप्लेन करेंगे डॉक्टर निधि कि प्रिवेंटिंग के लिए?
प्रिवेंशन में क्या होता है पारुल, जैसे आई जस्ट गिव अ ब्रीफ बैकग्राउंड. हमारी कल्चर में हम जैसे थैंक्स टू द जंक फूड इंडस्ट्री, लास्ट डिकेड में हम लोग बहुत जंक फूड, रेडिली अवेलेबल, कोल्ड प्रोसेस्ड, ये फूड पे बहुत रिलाई करने लगे हैं, है ना. लेकिन हमारे इंडियन कल्चर में वी यूज्ड टू ऑलवेज हैव लोकली ग्रोन, कोस्टल एरिया में जो रहते थे they used to relish that food, but now each and every kind of food is available everywhere.
Yes,
right. So what has disrupted our eating habits? One, our mouth or our teeth is still not, it is still not able to adapt itself to such wide range of exposure of food, क्योंकि उसका इक्विलिब्रियम तो बना हुआ है, right? But when we expose on a continuous basis, हर 1 घंटे में कुछ खा रहे हैं, either we having Coca-Cola or drinks or junk food, so the equilibrium is, वो पूरा disrupt हो जाता है, उसको हमारे को फिर से इक्विलिब्रियम में लाने के लिए we have to really work. या तो हम दांतों के बिल्कुल पुट अ कोटिंग ऑन इट, वो तो पॉसिबल नहीं है. और वी चेंज द फूड हैबिट, और वी कीप द क्लीनिंग हैबिट्स और द डाइटरी और द डेंटल ओरल हाइजीन हैबिट्स इन प्लेस, राइट. तो ये ट्राइडेंट है, हमें इन तीनों को ही एक साथ लेके चलना है. हमें डाइटरी हैबिट्स को भी ठीक रखना है, हमने अपने क्लीनिंग हैबिट्स को भी ठीक रखना है, और हमारे को टूथ के सरफेस को भी ठीक रखना है. नाउ डेंटिस्ट क्या कर सकता है? डेंटिस्ट आपके टूथ के सरफेस को ठीक रख सकता है, राइट? हाउ? बाय गिविंग यू प्रिवेंटिव मोडालिटीज, आर्टिफिशियल सीलेंट्स हो गया, या उसके अंदर फ्लोराइड वार्निश हो गया, या क्लीनिंग ऑफ टीथ हो गया, या आपको एक अर्ली प्रिवेंटिव मॉड्यूल बताते हैं जिसमें ये बताते हैं कि आपने ब्रश कब करना है, कैसे करना है, कौन सा करना है, which mouthwash to be used if it has to be used, what kind of checkups do you need? Do we need a very extensive kind of checkup under illumination and magnification where we check under microscope? अगर बच्चा या adult जो है वो prone है cavity के, तो हम एक disclosing solutions भी आते हैं जिसमें हम वो solutions को लगा के चेक करते हैं कि किस एरिया में बहुत ज्यादा प्लाक है, और उसके अकॉर्डिंगली हम उनको एक प्रिवेंटिव प्रोटोकॉल पे डालते हैं, एंड वी कीप द पेशेंट ऑन दैट प्रिवेंटिव प्रोटोकॉल एटलीस्ट फॉर 6 months, and then we ask the patient to maintain it for another 6 months, and if for a year the patient is not developing any cavity, then it is a success rate. Then we know now that the patient is good to go on its own. So ये बहुत एक systematic approach है, and now in times to come this is the need of the hour, because losing
यानी कि वो लाइफ स्टाइल में लाना होगा उस चीज को. जैसे हम बाकी चीजों पे ध्यान देते हैं आजकल, जैसे हर कोई ध्यान देने लगा है कि
It
मुझे
has to be
कोलेस्ट्रॉल
routine.
नहीं बढ़ाना है,
Yes.
इस तरह का खाना
It
खाना
has
है।
to be a routine. ये नहीं कि आज मन किया तो ब्रश कर नहीं किया तो नहीं किया। और it has to be twice because रात को जो brushing करते हैं that is more effective than the morning time brushing because
Yeah.
that 12 hours gap is it is good enough to decalcify your tooth. Enamel से minerals निकालने के लिए 12 घंटे बहुत ज्यादा है। अगर आप रात को ब्रश कर लेते हो तो मिनरल्स दोबारा डिपॉजिट हो जाते हैं सलाइवा से टूथ के ऊपर। इट्स अ टू वे प्रोसेस
यानी कि
डिपेंडिंग अपॉन यू।
जैसे बुद्धिज्म में कहते हैं ना कि एक सम्यक मार्ग होना चाहिए, सम्यक होना चाहिए, एक साम्य अपनी लाइफ में,
सम्यक ज्ञान, सम्यक दर्शन, सम्यक
हाँ,
दर्शन।
तो साम्य बना के हमें लाइफ का चलना चाहिए कि हर एक चीज का, कहीं भी आप एक्सट्रीम जाएंगे तो वो हर एक चीज पे पड़ेगा, सेम हमारे दांतों पे भी वही असर होगा।
Yeah, and ritually if we follow
और ये जरूरी नहीं है आप अपने डेंटिस्ट को तभी दिखो जब पेन हो। That is not preventive.
ये मैं पूछना चाह रही थी आपसे कि रेगुलर चेकअप विदाउट पेन।
Yeah, preventive is even when the pain will start because that is preventive. It is necessary nowadays that you see your dentist. I am not saying take the treatment from the dentist. I am not saying you go for cleaning. It may be needed, it may not be needed depending upon your dentist judgment. Yes. But go and at least show once in 6 months because as I told you, cavity may take from 6 months to 5 years to progress through all the stages. So if at that initial stage, your dentist will definitely help you to reverse it. And it is possible. With the advancement of techniques, technologies, knowledge, so much happening, it is possible you can reverse your cavity. I have done mine. I reversed mine. So can you. So that is what
जो आपने फोटो दिखाया है उसमें जो अर्ली स्टेज वाली है, अगर वहीं पे हम पहुंच जाते हैं तो हमारा दांत बहुत हद तक बचाया जा सकता है,
बच जाता है। बिकॉज क्या होता है, देखो अगर हम लीवर इज वन पार्ट जिसका आप 1/3 पोर्शन भी बॉडी में रख दोगे तो रीजनरेट, tooth will not regenerate, tooth never regenerates, it's a irreversible process. जरा भी आपका गया तो you have to go for a filling, and filling what, it's again an artificial thing, it's not a natural thing. How natural it may look, but it's still a filling. And filling, see, if the natural tooth is prone to decay, then decay can happen under the filling also. We have to see this. filling के नीचे भी हो सकती है decay, कीड़ा लग सकता है। हाँ,
अच्छा।
And one thing, one fact I'll tell you, हमारी जो बॉडी है उसमें सबसे हार्डेस्ट जो थिंग है वो हमारा इनामल है, इवन हार्डर देन योर बोन, सैमी की बोन। स्कल से भी, खोपड़ी से भी ज्यादा मजबूत तो दांत है। That means they are meant to be with us till our last. God made them like this. We don't realize it.
It remains even after you're gone. So
Yeah.
that is.
Yes.
You find the dentures of fossils and those extinct animals and all. So yes, we need to be very, very careful. See, the worst part of Parul and Dr. Nidhi is till the time this body is working, we are not bothered about its maintenance. We only land up to the doctors when we start feeling pain, and then also when it becomes unbearable and it is hampering our daily life.
Absolutely, Sammy. We go for the servicing of our cars. Though they are limited edition, they will remain there only for some years. But हमारी कार पे स्क्रैच नहीं आना चाहिए.
How we care for them? Oh my God.
बहुत अच्छा उदाहरण आपने दिया है.
Why not for your own thing, your body, your own health? It will remain forever. Your car will not remain forever.
And tooth are also, Dr. Nidhi, tooth are also directly related to your food. I mean, your ultimate energy, source of energy. If imagine if you have like I have been through those stages when my back teeth of one side did not support. To compensate that area, I started eating from one side, and it has compromised the other portion of denture also.
So God has given us on both the side and why two jaws to balance it. Because if you don't eat from one side, then this will start atrophying, and this will start hypertrophying. Then there will be imbalance in the bite, the whole jaw orientation. That is why we tell our children also chew from both the sides. I think the word which is maximum used with our children is chew your food. We don't chew our food. They see us. So we just gulp it down. We tell them chew your food 32 times. Why everyone says that? Because when we chew more, we utilize it more. The secretion of saliva is more. We are actually digesting the food in the mouth. Mouth is the first organ for our GI. सब GI की बात करते हैं. This tract अपने गट की बात करते हैं. गट का पहला पार्ट तो ये है. यहाँ पे इतने सारे एंजाइम्स हैं. इनको सीक्रेट होने के लिए हम टाइम ही नहीं देते. We just gulp it down.
बहुत
Chew your food here nicely. When you chew your food, even the sensation that you are full will come. Our children don't chew food. The sensation doesn't come. They overeat.
इसीलिए वो मैसेज
And the nutrition is also absorbed, nicely when we chew our food. Because we are breaking it down. We are making it accessible for digestion and all. So chewing is very important. But if you have cavities, you have deranged bite, how will you chew your food? So,
डॉक्टर निधि, यहाँ एक बात जानना चाहूंगी कि जो हमारी अकल दाढ़ आती हैं, जो विजडम टूथ आते हैं पीछे हमारे, तो क्या वो हमारे च्यूइंग में कुछ फायदा करते हैं, हेल्प करते हैं, या वो आते ही उन्हें निकलवा देना चाहिए क्योंकि एक और जगह बेकार कैविटी की दांत में रह जाती है और जब वो निकलते हैं?
पारुल, इसमें क्या होता है, देखो एवोल्यूशन हमें सबको समझ आता है. विद एज वी आर मतलब विद टाइम वी ऑल आर इवॉल्विंग. जो हमारा अपेंडिक्स था, दैट हैज बिकम अ वेस्टिजियल ऑर्गन. टेल होती थी हमारे पास, हमारे कान मूव करते थे, हमारे हमारे फोर फादर्स, सॉरी उनके एंसेस्टर्स
5000 साल वाले पहले वाले
हमारे नहीं करते, बिकॉज हम लोगों को नहीं चाहिए. वी हैव इरेक्ट पोस्चर, वी कैन सी थ्रू आवर आईज, वी कैन मूव इन एवरी डायरेक्शन. वी डोंट नीड अपेंडिक्स that, or we don't need tails now. With evolution, what has happened, जब men has started adapting to more and more refined diet, our jaw has become smaller. तो ये wisdom teeth जो है, जो कि actually 18 साल के एज पे इरप्ट होते हैं, that is why they used to be called wisdom teeth, because generally they say कि इस टाइम पे बुद्धि आती है.
मुझे अभी क्यों आ रहा है, फिर मुझे अभी आ रहा है, अभी आधे में है.
You are getting more wisdom, Parul.
I'll tell you. So उसमें क्या हो गया कि उनकी जगह ही नहीं है now, so they get stuck in the bone. They don't erupt. But if they erupt well, if they are in bite, you can clean them well. There is no need for extraction. Keep them in mouth. Another set of teeth for chewing food. No harm. But if they are not, they are not in line, they are not helping in chewing, they are rather giving you problem, better get them extracted before it's too late, because sometimes the fully impacted wisdom teeth can cause cyst formation also in the bone, though rarely, but it happens. 18 से 25 साल तक में जितने इरप्ट हो गए, उसके बाद निकलवा दो, नहीं होते तो,
है ना? हाँ.
Clear cut guidance. I mean, there's no point keeping them, because when they are not in bite, you are not able to clean them. They are more prone to caries and give you pain, and may give caries to the adjacent tooth also. So better take them out.
Yes. मुझे लगता है अगर आप लोग कोई सवाल पूछना चाहते हैं तो आप डॉक्टर निधि से पूछ सकते हैं, ठीक है, हैंड रेज करके.
Yeah, if you have any dental issue and you would, हाँ, Subhashini, yes. Ashish, you have to wait.
Yes,
We'll ask the
आते हैं आपके पास.
Good evening, ma'am. Actually, my question is not regarding cavity, but is it okay if I ask something else regarding the lux teeth only?
Yes.
But not regarding cavity. Actually, for upper jaw expansion, we went to a doctor, orthodontist. So he said there are a lot of milk teeth in his mouth, so it's better to extract. So he suggested 4 down and 4 up milk teeth to be extracted, so that we can start the process of upper jaw expansion.
Okay, so if they are over retained and if the permanent teeth have come, I mean, if they warrant removal, then only you get it removed after doing the OPG. Or you can send me the OPG, you can send me, I'll have a look, and then maybe we can have an opinion how to go about it.
Actually, what he suggested is before doing the upper jaw expansion, it's better to do this extraction to be done. Like that. So we have already gone.
Extraction we do only if it is over retained, if the permanent teeth have erupted, and if it is causing any problem in the eruption of permanent teeth. If they are over retained, then yes, the baby teeth, they will need removal. Whether it is for expansion or not, that is secondary. Over retained teeth will need removal. That is for sure.
It's not, I don't think that permanent teeth were coming, so it is causing a problem for milk teeth.
Yeah, so
but
if permanent teeth are erupting, you have seen it on OPG. The doctor has cross-checked and seen that yes, on OPG they are visible. The teeth bud are formed. Then yes, removal can be a better choice.
already we have done two left side and two right side down one.
Yeah.
So teeth got extracted, but it's become almost 1.5 to 2 months. He didn't get any little bit of teeth also from that area where we
But
have.
they were seen on OPG, na? They were seen on the X-ray.
Yeah.
So they will erupt. Don't worry, they will erupt. Thyroid level is under control, na?
Yeah, it's controlled.
Yeah, they will erupt.
Actually they told to take out 4 teeth from upper jaw also, but we were scared. But already 4 down teeth extracted, and if we take upper teeth also, then how he will eat chewing and all, it will become a problematic, no? So we said we will wait for some more time, like that.
Okay. You can send the OPG also if you want me to have a look. I can.
Yeah. Okay. Like generally, how long it will take, ma'am, to come the teeth, to get the permanent teeth?
It's all variable. It's all variable. It may sometimes the permanent tooth is already in the mouth and we remove the baby tooth. Sometimes it just takes 15 days that for the tip to emerge. Sometimes a month, sometimes 2 months. So it's all variable.
It's almost 2 months become, but we cannot see little bit also in that area. So
yeah. So better to wait, because if they are seen on OPG, they will erupt. Don't worry.
Okay, ma'am. Thank you.
Yeah.
Otherwise, also, Subhashini, you can send your details or the reports to Nidhi ma'am, and she can have a look, to get a better idea.
Yes.
Because sometimes we are not able to exactly state the situation what actually is. Thank you, Subhashini. Ashish, आपको कुछ पूछना था?
यस, आपने कहा था मैडम कि मुंह में जो ब्लॉक हो जाते हैं तो क्या वो इससे साफ हो जाएंगे क्या, ओमनी डेंट से? इससे मैं ये यूज करता हूँ ओमनी डेंट
के लिए। वो ब्लॉक के लिए बोल रहे हैं।
ब्लॉक
प्लाक की तो टेंशन नहीं लेनी चाहिए, क्योंकि प्लाक तो अगर आपने ब्रश भी कर लिया अच्छे से, फिर से 15 मिनट में आ जाता है। प्लाक का प्रॉब्लम नहीं है, प्लाक तो इट इज गुड, क्योंकि उसके अंदर सारा सलाइवा के मिनरल्स प्रेसिपिटेट होकर दांत पे डिपॉजिट हो जाते हैं। लेकिन हमारे को इस चीज का ध्यान रखना। हाँ, आप अगर आपके डेंटिस्ट ने रिकमेंड किया है आशीष, तो आप वो ले सकते हो। आपके डेंटिस्ट को पता होगा कि उन्होंने आपको क्यों प्रेस्क्राइब किया है।
और इसे माउथ वॉश करता हूँ मैं इससे।
हाँ, अगर आपके डेंटिस्ट को पता है और उन्होंने दिया है तो आप कर सकते हो। लेकिन अगर आप खुद ही से कर रहे हो तो एक बार डेंटिस्ट के पास जाके कंसल्ट कर सकते हो कि मैं ये करूं या कब तक करता रहूं, कि इसके कोई साइड इफेक्ट तो नहीं है।
ठीक है, डेंटिस्ट नहीं दिया है मेरे को ये।
अच्छा, फिर तो बहुत बढ़िया है आशीष, गुड। ये तो आपके अच्छे होंगे, दांत चमकते होंगे।
I know, he must be having the best of the oral hygiene, and he's
हमारे टाइम में
his smile is so beautiful.
हमारे टाइम में एक वो आता था ना, समीक्षा, राजू तुम्हारे दांत तो मोतियों
जैसे चमक रहे। Yes, there was an advertisement, and that has, I think, you and me and our generation still use it in our houses and in our friends and family socials to, appreciate or to just, give a funny nudge to any of our friends or family members, right? So, yeah. It is really wonderful to have a beautiful smile, and taking care of that smile is also our responsibility. And yes, Nidhi rightly mentioned, because me being a dental patient for a very, very, very long time, and still I am visiting Dr. Nidhi. My visit is overdue for the review. And but if you keep your tooth, healthy and under observation, and repeatedly checkup is done, you will enjoy the best of food.
Yes.
And
यानी मुझे उससे एक बात और याद आई, हमारे दिखाने के दांत कुछ और होते हैं, खाने के कुछ और।
exactly.
लेकिन जो हमारे दिखाने के दांत होते हैं ना, वो स्माइल तो है। देखो आजकल एवरीवन वांट्स अ गुड ब्यूटीफुल स्माइल थैंक्स टू द सोशल मीडिया। वी ऑल वांट टू बी ऑन टिकटॉक, इंस्टा, फेसबुक, एवरीवेयर। बट हाँ, दैट आल्सो ब्रिंग्स इन द रिस्पांसिबिलिटी टू कंजर्व एंड प्रिजर्व इट। बट जो ये दिखाने के दांत है, स्पीच के लिए भी बहुत जरूरी है।
Exactly.
Imagine just 0.5 mm of gap between your teeth and the lip sync starts. Or just think if somebody has lost a tooth, or if we see our grandparents, how they used to really struggle with those dentures and how, you know, their speech used to get altered.
Yeah.
So these teeth are very, very important, but back teeth are very important. The molars, जाड़ बोलते हैं हम इन्हें, क्योंकि खाने के तो वही है ना।
Exactly.
आएंगे नहीं तो न्यूट्रिशन कैसे आएगा?
2 घंटा बोलने के बाद जब भूख लगेगी तो वही काम आएंगे।
Exactly.
और एक और चीज, जब तक ये दांत रहे आगे के पीछे के, आपके मसल्स को सपोर्ट करते हैं। दे मेक यू लुक यंग आल्सो।
Yeah.
दे आर
हाँ,
सपोर्टिंग।
तो यंग कैसे रह सकते हैं ये बताइए।
Your teeth will always remain young if you keep growing up.
Visit your dentist regularly.
Yeah.
अच्छा, डॉक्टर निधि, जो कैविटी के लिए आप फिलिंग करते हैं वो एक बार में ये है कि हो गई, और जब तक वो नेक्स्ट टाइम आपको प्रॉब्लम ना करे तब तक के लिए वो चल जाएगी ना, ये उसके लिए भी कोई वो रहता है?
प्रॉब्लम मतलब क्या, मैंने बताया फिलिंग के नीचे भी कैविटी लग सकती है। ओनली द थिंग इज गो फॉर रेगुलर चेकअप। योर डेंटिस्ट विल चेक कि उसके नीचे कहीं कैविटी तो नहीं आ रही है, और अगर लगता है कि प्रोन हो तो वो पहले से ही ध्यान रखेंगे कि आपको प्रिवेंटिव प्रोटोकॉल पे डाल दें।
और अगर हमारा दांत हमें लग रहा है कि नहीं, हमें तो रूट कैनाल की तरफ जाना ही पड़ेगा, तो उसके लिए पेन होने तक का वेट करना चाहिए या करा लेने चाहिए?
नहीं 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 नहीं।
पेन
I
के
just had a patient just before the webinar. आज क्या हुआ, लैपटॉप भी कॉन्क ऑफ हो गया। I was like, yeah, okay, I have to maybe do it by my phone. And I had a patient sitting. I had to do 4 root canal of her. She did not have a single pain. Last night only she had a headache and a radiating pain in the ear. So I asked her, what were you waiting for actually? The 4 teeth were badly decayed. She could not see. बस वो ऊपर से दिखता है तो ठीक है. But she said, I asked her so many questions. Did you have food lodgement? Did you have to brush every time you eat? She said yes. मैंने कहा, then what were you waiting for? Once you feel, you know, even slightest of food lodgement between your teeth, that means there is some problem. Somewhere something is not in place. Better show it to the dentist. You may not need filling every time. You may not need any corrective measure. Maybe the preventive measures will help. Yeah, but if your doctor has said it needs a root canal because now the nerve of the tooth is involved, don't wait for the pain to come, because pain is really killing. Toothache is the worst pain. Don't let it happen to you. Rather go for the treatment as suggested by your dentist.
अच्छा, एक जो वायदा मैंने अपने दोस्तों से प्रोग्राम शुरू होने के समय किया था डॉक्टर निधि, कि डॉक्टर निधि जो है वो पेनलेस ट्रीटमेंट देती हैं, तो एज अ डेंटिस्ट आप ऐसा कैसे कर सकती हैं कि पेनलेस ट्रीटमेंट?
मैंने बताया ना,
डेंटिस्ट का तो नाम ही दर्द होता है हमारे साथ।
The heart, mind and teeth all together I do.
Yes.
It's become painless.
And it is painless for the patient, but not for her, because she has to be in a posture constantly to drill one side of your tooth root, which our molars generally have 4, if I'm correct, Dr. Nidhi. And it takes really a toll on her back. And I have seen her after correcting my tooth that how much pain she was in. So it is painless for me, but not for my doctor.
Thank you, Sammy, for understanding that. There are very few people who understand that the doctor actually, you know, when we say will heal you painlessly, actually it's a lot of stress we take upon ourselves to put on that smile on our face so that you don't see what is going on in our mind and in our heart, you know. But yes, Parul, with lots of advancements in technology, the main crux is how you keep yourself updated. So with that one good news I wanted to crack with you, Rekhama already knows that we have now in-house World's #1 scanner. It's a digital scanner. It scans your full mouth, and it in the real time it shows what is happening in your mouth. And we plan the treatment beforehand so that you see how your teeth will look like after the treatment.
Wow.
So it was the only technology we were missing, and now we have it in-house.
Wow.
So it's
This
the
is
constant
the
endeavor to upgrade yourself with your
Yeah.
knowledge, technology, with your skills, I think.
Yeah.
Which keeps,
Thank you,
to-
Dr. Nidhi, for that. And Parul, and thanks to DSFI, many thanks to DSFI. And parents understand this is the beauty of this platform, that a parent, being an expert in an area, keeping abreast with the technology, getting you the most latest and advanced, information and treatment and technology to treat you to live a better life. I mean,
Actually,
only on this platform it can happen, right?
yes,
बिल्कुल
only
आपके
with
जिंदगी को
DSFI this can happen with the Humsafar family.
दोस्तों, आपका कोई सवाल है तो आप डॉक्टर निधि से पूछ सकते हैं। अपने या बच्चे के किसी भी दांत के बारे में पूछ सकते हैं। ऐसा नहीं है कि आप अपने दांतों के बारे में नहीं पूछ सकते हैं। अपना आपका कोई भी क्वेश्चन है, कोई भी क्वेरी है, तो आप डॉक्टर निधि से बात कर सकते हैं।
Hello, ma'am.
Yeah, please. Can we see
Ma'am,
you? Hima,
one
yeah,
second.
Bindu, yeah, Hima,
Yes,
Bindu,
yes,
your
ma'am.
name.
Ma'am,
Hi.
good evening. Ma'am.
Hello, ma'am. Good evening.
My name is Hima Bindu, ma'am. Actually, my daughter is a Down syndrome baby. She's having diabetic, ma'am. So her teeth are like after coming diabetes has recognized. Her teeth have become completely yellowish, ma'am. So now also I have showed to some other doctors. I have shown in NAMH also. Some doctors has come there and I have shown them. They say the teeth are okay, but some cleaning still it is in yellowish only, ma'am. But I'm a little bit worried. What should I do? They didn't tell me clarity of like what should I do. They didn't give me anything like that. So
what is the age
can I?
of your daughter?
Smiley, Sunny, ma'am. Excuse me, yes, ma'am.
What is
She
the
could not
age
hear.
of your
She's
daughter?
17 years. She's 17 years, ma'am.
Okay. She's on any medication, on any syrup?
Yes, ma'am. She's having thyroid, ma'am. Thyroid, and also she's in insulin, ma'am. Now, she's having breakfast, lunch, and dinner. She's having insulin, and at night she will take a pen insulin also. She's my daughter, ma'am. Sanvi.
Hello, Stanley. Okay, listen. Yellowing of teeth is not a problem unless and until there is some layer of calculus. Calculus is
Yes, ma'am. That layer has come on a teeth, ma'am. Not only yellowish, it became the layer type of this thing has happened in the
that
teeth
needs
between.
to be cleaned, and don't worry, this is easily done. So you can take her to the dentist, and it can be easily done. Nowadays, ultrasonic cleaners are there, so they don't make so much of noise. They don't give that feeling. So it's safe for our kids.
Okay. She's diabetic. That's what I'm a little bit worried. Like, is it okay for her to do all this?
Get it done. It's safe. No problem. Just maybe if she has not visited any dentist or she has an anxiety, go visit the dentist without the procedure. Just make a repo, hi, hello, see the operatory, things like that. Maybe in the second sitting, she will get more friendly and get it done. So don't worry. Your dentist will know how to make her comfortable. There are many methods we use in our clinical setting where we know how to make them, comfortable. Because our aim is to get the work done, and their aim is not to get it done. But we use all the tricks and techniques to get it done, and that too painlessly with a smile. So don't worry, it will be happy.
Okay.
So Hima,
And
Bindu,
my
you need to be friends with the dentist first, and then start as a social visit, and then it can go to the procedure.
Yes, I have.
Yeah, please.
And my husband is also having one tooth like a cavity, ma'am. So can I ask for that also, ma'am? Is it okay? Like you just
Go ahead. Husband's tooth should be fine.
Thank you.
Yeah, please.
So he's suffering with a cavity, ma'am, between the two teeth in between. The cavity has come, ma'am. Like, so he's getting severe pain. Morning time, he's having nothing pain in between. Night, after eating or before eating also, he's getting that pain been started in the night, ma'am. Most probably night it is getting pain. So
show it to the dentist as soon as possible before it gets worse.
he has shown, ma'am. He has shown, but he's telling that it's not feeling that. You have to put another teeth in between, like that. Something he's telling. So he was
I'm sorry,
little bit.
but on this platform, I can't give you the exact consultation. You have to
Okay.
be
Can
offline. You have to be in person with the dentist to get that consultation, because your
Ma'am, you are
words
from like
vary from what actually the
Delhi.
picture.
Hima, you muted yourself. Hima Bindu, you muted yourself. We can't hear you.
hello,
We can hear you.
ma'am.
Yeah, she's in Delhi. Dr. Nidhi Gupta is based in Delhi. Yeah.
Okay.
Where are you based, Hima?
We are from Hyderabad, ma'am. From Hyderabad.
Hyderabad.
Oh.
Hyderabad must be having good dentists, right, Dr. Nidhi?
Yes, yes. Everywhere you'll find good dentist. Don't worry.
Yeah. And a good dentist who can relieve you with the pain
Okay.
painlessly.
Yes, yes. Ma'am.
So any other parent wants to ask?
Thank you.
Or we
Thank
can
you so
ask
much.
Dr. Yeah, thank you, Hima. We can ask Dr. Nidhi, please share some experience or some encouraging experience. You have been treating our children and their parents, right? So many times. Anything comes in your mind where you know you would like to
So I
state?
remember, Sammy, generally we all talk about early intervention and we talk about our small kiddos going to therapies and then dentist. But somewhere the needs for the adults, it's always, it's always on the back. Uh, so, I mean, the need never arised actually to address their issues. But now actually DSFI only has given us this opportunity that how we can help even adults correct their bite, help them chew better. So I remember we were doing some workshops in the month of February, March, April on toothbrushing. So this parent, she shared her experience. Actually, she gave that her child is she has an adult now with Down syndrome, and how in spite of going to therapies and not able to understand why he is not chewing food and he is not brushing, even sensitivity to brushing. But she told me that how we broke it down, the whole process, we broke it down in very simple steps, doable steps, practical according to him, according to his needs. And after some months now he's able to chew food also. He's chewing, he's brushing, the sensitivity issues have gone down. So maybe it's very small things, very small chains are, links are missing to complete that chain. So somewhere I also feel that need that the role of it, not I am as a dentist, I'm saying that, but the role of the dentist is really, it's multi-pronged. It is, and from the early intervention till the child adulthood, the child goes to the adulthood. Those years are also important because our children and adults with Down syndrome are prone not only to cavities but also to gum problems. In fact, we as Indian population were always prone to gum problems rather than the cavities because our food was good for our teeth.
Yeah.
But it is because we lacked on the cleanliness, on the cleaning or the oral hygiene habits, we were more prone to actually the gum disease. Now our children are now equally exposed to all the opportunities as neurotypical kids. They go to the malls, they relish the same kind of food as others. So they are also now having the equal incidence of caries. They also are prone to the same level of cavities through the tooth decay. But as compared to the other population, they are more prone for the gum disease. I have seen adult with Down syndrome, 29 years, 2 teeth just gone. I'm like, what? Just gone means it just came out of the mouth on its own. Why? Because they were having gum disease. So we have to be really, really, really careful about not only the teeth, not the brushing, but how you clean the gums. You know, gum part is very important because below it is the bone to which the tooth is attached.
और डॉक्टर निधि, कई बार ऐसा होता है कि वो दांत जो आप कह रहे हैं गम से निकल गया है, कई बार ऐसा होता है बीच में से टूट जाता है, आधा टूट गया या कोई हिस्सा दांत का टूट गया, तो वो क्या इनेमल कमजोर होता है?
नहीं, वो तो कैविटी की वजह से टूटता है, unless and until it's a fracture or it's an accident, but mostly it's because of a cavity. Because see, that is what I'm saying, most of the time हमें लगता है cavity ऊपर लगी है दांत के ऊपर, और हम देख के हम we become the you know कि हाँ,
we become experts for our own.
cavity लगी है वो नहीं देख पाते हैं ना, that you cannot see, that you need
वो
some
एक्सरे
to
होके ही
help
पता
you.
लगेगा.
Yeah.
Instrument, yeah, clinical diagnosis, then X-rays, so many things.
And the tools and techniques the dentist use in your mouth, I mean, they can reach you to the areas you can't see otherwise. Komal has raised hand. Komal, would you like to unmute and ask?
Yeah. Good evening, doctor. I'm Komal Jain, calling from Chennai. Doctor, actually, my daughter is 11 months old and she has not got even her first teeth. Is I need to worry anything about, or
She has not got what?
Anything.
her first teeth?
She's 11 months.
You got 11 months. 11 months, don't worry. We'll wait till 2.5 years, and in our children 3.5 years for complete 20 teeth to erupt. Sometimes 20 teeth may not erupt. Sometimes they may be on some teeth. Don't worry, just give lot of oral stimulation. The chew tubes you must have been suggested by someone, or if you have not yet switched to solid diet, maybe that is one thing where you can introduce small bits and bits of solid diet. Not completely solid, but maybe that
solid.
Yeah. So you need to stimulate give lot of stimulation on the gum patch. They help in the eruption of teeth holes. But you have to keep a check on the thyroid level, vitamin D. These are two things which help in the eruption of teeth.
Okay. Thyroid level and vitamin D, we need to have a check.
Yes. If you have not done it, then it is needed. In I think 6 months, every 6 months.
Okay. Anyway, we are going to check thyroid and report to our pediatrician. Can we report this vitamin D?
Is the best to help you in that.
Can we report the vitamin D report also to the pediatrician? Will they be able to help me?
Yes. The aim is that they should come within the normal range.
Thank you, doctor.
Thank you, Komal. Varsha, you have raised hands. You can ask.
Good evening, ma'am. My son is 14 years old and his upper jaw is not developed compared to his lower one. So we have shown it to orthodontist and he has suggested that the upper jaw expansion can be done only after 18. He is 18. So I just want to know, is that okay? And it can be done with the surgery. So this is what suggestion has given.
Varsha, I would like to connect with you on one-on-one basis because some investigation we will need before we come to the conclusion.
Okay. We have taken X-rays.
8 to 12 year is the golden period where we suggest maxillary expansion, the upper jaw expansion. But still, if you have my number,
he is already 14, ma'am. So that is why
that is what I'm saying. That is what I'm saying, that I would connect with you on one-on-one basis because.
Varsha, you have Dr. Nidhi's number?
No, I don't have.
Okay, so you can take it from Brenda or you can ask in any group. She is part. If we are present there, we will send you. Or Nidhi, you can put it in chat box quickly. Komal has again raised hand. Yes, Komal, kaun se daant mein dard hua abhi?
नहीं मैम, एक्चुअली क्या प्रॉब्लम हो रहा है, मेरे को भी आके यहाँ पे लेफ्ट हैंड साइड में थोड़ा सा सेंसिटिविटी। एक मिनट मैम,
Varsha,
स्क्रीन
you
ही
can
आ रहा
hold
है।
the number. Nah,
Yeah, yeah.
Komal, we can see you, we can hear you.
तो मैम एक्चुअली मेरे ना सेंसिटिविटी जैसे है, कुछ भी कोल्ड या फिर चॉकलेट खाऊं तो मेरे को बहुत बहुत प्रॉब्लम होती है। तो इसका क्या इलाज है मैम? शुड आई नीड टू कंसल्ट डेंटिस्ट और इट विल गेट?
Yeah, please consult a dentist. Don't do home remedies.
और अकेले मत खाओ, हमें भी भेजो।
मुझे लगता है ये सेशन जो है ना, ये क्रिसमस का फ्री बन जाए, जो उसमें चेंज हो गया कि आज फ्री कंसल्टेशन हो जाए। नहीं, अगर सेंसिटिविटी है तो इसका मतलब जरूर कोमल कोई प्रॉब्लम है जो आपको दिखानी ही पड़ेगी
कोमल,
यहाँ से।
दिखा के आओ पक्का,
क्या मैम?
दिखा के आओ डेंटिस्ट को।
Show
ओके
it to
ओके
your
मैम।
doctor.
नो, वो बोलते हैं ना सेंसोडाइन टूथपेस्ट यूज करोगे तो प्रॉब्लम नहीं होगी, उससे एक
आपको सेंसोडाइन की हाँ करवानी है डॉक्टर निधि, बस आप इतना कह दो हाँ सेंसोडाइन तो 6 महीने गए कोमल।
नहीं, we don't recommend that, Komal, unless and until you don't see a dentist. Please don't use these medicated toothpaste. Only for some people it is good, for other it is harmful. And don't go by Google Baba, please, because Google Baba, if you consult Google Baba, it will lead to casualty. So
Okay,
don't
okay.
have a
Thank you, ma'am.
casual approach, please.
थैंक यू सो मच मैम। थैंक यू डॉक्टर।
जो गूगल की रिसर्च में मैं आपको बताऊं, जो गूगल की सर्च में रिजल्ट आते हैं, उन्हें ये देखना होगा कि वो किस वेबसाइट से हैं। हमेशा कोई ऑथेंटिक वेबसाइट से आपको यूज करना होगा, क्योंकि बहुत सारे ब्लॉगर्स हैं जो रैंक होने के लिए और पैसा कमाने के लिए वो सारी जानकारियां वहां लिखते हैं। तो हर एक जानकारी गूगल पे ऑथेंटिक नहीं होती है।
थैंक यू मैम।
Yes, and it's nice to abhi to, I mean, there are so many professional ways we can follow and consult a doctor in person. And health to kabhi bhi you know, in without in person consultation nahi hona chahiye, I would recommend, right Dr. Nidhi? Health is you know, something. और खाना तो एक चीज है, आई थिंक पारुल, सब कुछ, सारी मेहनत, सारी दौड़ भाग जिंदगी की यही है कि 2 वक्त की रोटी आराम से बंदा खाए, और दांत अगर हेल्दी होंगे
आराम से, Sammy.
और दांत अगर हेल्दी होंगे तो आई मीन यू विल एंजॉय द बेस्टेस्ट ऑफ द फ्लेवर्स ऑफ द सीजन, द क्रिसमस, एंड यू नो, गो एनी पार्ट ऑफ द इंडिया एंड यू विल एंजॉय द क्विजीन, राइट?
मुझे लगता है बहुत अच्छे, कुछ ज्यादा ही अनुभव दांतों के बारे में हमारी सैमी को हुए हैं।
दांत बने ये कि हम जम्मू कश्मीर से लेकर कन्याकुमारी की सारी डिशेस सेवा कर सके, समझ।
और
I have a lot more, Parul, for your records, I have more experience of being a dental patient than the doctor's practice. And Nidhi, she knows my oral health. She's been into every corner of my mouth, you know, with her tools.
बहुत ही परेशानी वाला।
Sammy, I forgot where all I had been to, which corner I had been to. You have to come.
I know, I have to see you again.
दोस्तों, ये आज का हमारा सेशन था और बहुत मजा आया, क्योंकि इसमें मेरी दोस्त समीक्षा भी लौट के आई है, तो वापस से हमारा पूरा बातों में वही रस और वही सब अपनापन जैसा लगा। मुझे उम्मीद है आपको भी अच्छा लगा होगा। और छुट्टियां शुरू होने वाली हैं, विंटर वेकेशंस, और नॉर्थ में जो हैं वो पूरा सर्दियों का मजा ले ही रहे होंगे, मुझे उम्मीद है। तो आप लोग बने रहिए, अपनी जो है अपनी हेल्थ का और अपने दांतों की हेल्थ का बहुत बहुत ख्याल रखिए। डॉक्टर निधि, आपका एक बार फिर
और
से
सब केक खा सकते हैं मेरी तरफ से।
थैंक यू। सेंसोडाइन नहीं यूज कर सकते, लेकिन कपकेक खा सकते हैं।
Wishing you all a Merry Christmas and a Happy New Year.
Thank you,
Stay
thank you,
happy
Dr.
and
Nidhi.
healthy.
Yeah, and जो कल डाउन सिंड्रोम पेरेंट्स सोसाइटी दिल्ली के पिकनिक में आ रहे हैं, उनके लिए कपकेक्स रहेगा, and we are happy that Dr. Nidhi will be there to make sure that after eating it you rinse your mouth.
I'll get all the cups to make you rinse your mouth.
Thank you so much, Parul, and I'm happy to be back, and so sorry for missing in action for some time. Thanks a lot, everyone. Thank you, Parul.
Thank you,
Brinda.
Thank you. Thanks a lot, Nidhi. Bye-bye. See you. Thank you. Bye.
Merry Christmas.
Merry Christmas. Yeah, and Happy New Year to everyone. Bye-bye.
Yeah.
See you next week.
न्यू ईयर से पहले मिलेंगे अभी हम एक बार।
29th, yeah.
हाँ, 29th का हुआ यार, 31st
29
हुआ।
को आप सबको मैं बता रही हूँ,
29 को
बहुत अच्छा प्रोग्राम होने वाला है।
हाँ, और
Yes.
सब तैयार होके आइएगा. Please give us ideas for what you plan to do for World Down Syndrome Day
Yeah.
and the whole of next year.
Yeah, Vrunda. We are
Chalo.
preparing our calendar. Bye-bye.
Please do. Bye. Bye.